So with that said, let's get right into this and talk about what is disruption. So disruption, if you look in the dictionary, is going to be fairly obvious, right? It's going to be this definition right here. It's a disturbance, problems that interrupt an event, activity, or process. In healthcare right now, we know that there are a lot of different perspectives that we need to address. We need to be working on quality, we need to be working on outcomes, impact, be able to care for lots of individuals that don't necessarily have access to healthcare. All these different things, and we think that disruption and paying attention to what's coming at us is a way to be able to do this. But the way that I like to think about disruption is this specific definition right here, which is any force, either internal or external, that has the ability to fundamentally change or alter a business or clinical model. So if you think about disruption within that concept or within that definition, you can understand the importance of actually reaching out and grabbing things that might actually impact your organization. But more importantly, you've got to be watching for those things that may end up coming to you that may disrupt you and what you do. And this is a great example. I love this. I saw this at a meeting maybe 3 or 4 years ago. But if you think about digital disruption, it's already happened. You know, the examples of the largest taxi service doesn't have any physical taxis, which is an Uber, and I know that that's Uber and taxis are here in Ireland. But with regard to even the largest accommodations in hotels, you know, if you think about that, Airbnb is the largest one, but they have no physical property. Or if you think about, again, the largest and most valuable retailer with Alibaba, it's not any type of physical thing. So when you think about the disruption that's in place from a digital perspective, it's already happened. And we realize this almost every single day in the work that we end up doing, but then also as consumers. So disruption is everywhere, and again, if you're on any website or you're on LinkedIn or Twitter, you'll be able to see this in a matter of seconds. And what I want to do is to just very briefly go through a couple examples of these, and then we'll get a little bit deeper. So sometimes tiny is just the right size. In America, they have created what they call micro-hospitals. So you'll have an acute care hospital, but then if you're looking to go into another market, or perhaps you're looking to provide services in an area that's not necessarily supportive of a large academic medical center or a large hospital or community-based hospital, they've created these micro-hospitals, which are maybe 4 to 8 inpatient beds, primarily ambulatory focused. They have an ED, they have maybe 1 or 2 surgical rooms, etc. But they've put these outposts in these surrounding areas, and they're very disruptive, because what they'll do is they'll take potentially patients that could go somewhere else, or they end up feeding to the regular hospital. So micro-hospital is very disruptive. Robot therapists filling the gap for healthcare. What they found with autistic children is that actually they have responded very well to robots or AI, and able to make sure that they are be able to calm themselves or be able to relate to things around them. And they found this incredibly successful for autistic children. We talked a little bit about this in some ways, which is as you're looking further at understanding what's going on in the brain, there are different ways for you now to be able to see and possibly even predict Alzheimer's and dementia earlier on before you see some of the onset of it. And so just imagine what that could do for our healthcare environment when we're able to see that in advance and actually be able to start reacting to that before it starts to manifest itself. Smart inhalers. I'm not sure if anybody's heard or seen these before, but these are, again, a possible disruptor in a good way or a bad way, depending on how you look at it. But what they do is when somebody has the need for a smart inhaler, they go ahead and they'll take it, but there's the chip and the technology in it that will measure the conditions, the environment, information about you as a patient, and then that will communicate back to the care team and the care provider so that they can go ahead and have a fuller sense of what's really causing that. Who here has a wearable? Who here has more than one wearable? Yeah, so, and can I ask you if it's fundamentally changed your life and your health? Okay, no, but they're cool to wear, right? Anyway, so wearables, though, we talked about that yesterday, but there's wearables, there are absorbables, there are all these other types of technologies that are now coming in that help people to understand more about their health, and it's going to be becoming even more relevant and probably even more pronounced as we go forward. This is hard to see, I think, but a system on the West Coast, Providence, St. Joseph's, you know, the adage of the house call or the doctor going and making a house call has long been lost in the United States. However, now with an app and a ready force of skilled professionals as well as physicians, they are now identifying patients that are more appropriate for a house call. And so that is coming back, and this app has helped them to make sure that they're able to have primary care physicians or GPs actually go out to patients in their homes as a house call, which is a different way of doing things. Smart sutures. So when you have some sort of injury and you're taken care of, a smart suture is there in place, and what it does is as you heal, what it does is it continues to send information back to your care provider so that they can measure and make sure that you are healing appropriately, and you don't have to go back to see that physician again or that care provider again, because they're able to measure exactly how well that's healing. And then another one, which is as children go in for surgery, we know it's incredibly stressful, and so what they've done is they've adapted technology to where children will go in pre-surgery, and they will have a gaming system which helps them to go ahead and be very calm as they receive the anesthesia before they go in for the surgery. And what they've seen is the outcomes are so much better because of the patient going in the way they are and then coming out with the care they need to afterwards. So again, a quick snapshot of what you see out there, and again, not at all inclusive of everything that's